December begins with a global movement devoted to truth, a truth born from fear, silence, activism, and remarkable resilience. On this day, the world pauses to acknowledge a chapter in history, shaped by struggle and transformed by courage. In June of 1981, physicians reported rare infections among gay men in the United States. That medical bulletin marked the start of a crisis that revealed enormous prejudice within society. Instead of urgency, stigma overshadowed science. Instead of compassion, judgment grew louder than research. Gay men faced overwhelming loss during those early years. Many watched entire circles of friends disappear within months. Comfort often came only from those families because traditional support systems failed far too many. Homes, careers, and relationships collapsed under the weight of discrimination. During that same period, lesbian women emerged as pillars of care. They organized support networks, cooked meals, sat through appointments, managed home care, and stood in hospital rooms when others walked away. Their contributions shaped the foundation of queer solidarity long before the world recognized that heroism. Communities of color confronted a different obstacle: a lack of outreach. Public campaigns focused heavily on white populations, created fatal gaps in education and testing. Neighborhoods without reliable healthcare resources face even greater danger, and those disparities caused countless avoidable tragedies. While grief spread, activists refused submission. Groups like ACT UP confronted government inaction with bold demonstrations. Strategic disruption and relentless pressure. Their work forced institutions to accelerate research, approve new medications, and adjust public policy. Every breakthrough and treatment traces back to those who demanded change when silence dominated the narrative. Medical advancements continue to evolve. Prevention strategies developed. Treatment plans strengthened. Testing became more accessible. These achievements came from determination, sacrifice, and knowledge built through lived experience, grassroots advocacy, and scientific persistence. World AIDS Day recognizes these journeys. The day honors queer history, acknowledges neglected voices, and elevates communities pushed into the margins. This observance also encourages deeper understanding of how prejudice shaped outcomes and why equitable healthcare for every person remains essential. For individuals living with HIV today, your presence carries meaning far beyond a diagnosis. Access to medication, supportive care, and unbiased information continues to expand because of your strength and ongoing visibility. For families remembering loved ones, this day holds space for reflection. Names, faces, laughter, and traditions remain alive in memory. Those moments continue shaping the stories shared across generations. For caregivers, your devotion mattered. Lives were extended because you showed up. You brought steadiness during chaos, reassurance during panic, and humanity during uncertainty. For anyone learning this history today, understand that the epidemic revealed societal fractures. Homophobia, racism, economic inequality, and institutional neglect. Acknowledging those truths prevent repetition and guides us towards better choices. Public awareness, inconclusive education, brought across to healthcare, and open conversation remain essential. Progress loses value when those most vulnerable continue facing barrier. Today stands as a reminder that dignity must never depend on circumstance. Support must never hinge on orientation, identity, background, or income. Humanity demands consistency and compassion. May this day strengthen our commitment to empathy, honest dialogue, and responsible action. The individuals lost during those decades shaped history through their strength. Their stories continue to guide us toward a more just world. Their courage remains our compass.